And we are really excited about our special event today. And not very often do we get to hear from Jeff Rowley. Jeff is our claims manager here at the Trust, and he comes with a long resume of experience in the claims and risk management world. And we are really appreciative that we've got Jeff here to talk to us today about the corridor of care. How do we get the best outcomes from our workers' compensation claims? How do we get people healthy as soon as we can? Jeff.
Thank you for that introduction, and I'm pleased to be here today. Let's begin today. I'm the claims manager for the Trust. I've been here for 4 years, but have been handling claims for public entities for 32 years now. And for some reason, I'm just a weirdo in that I have a real passion for workers' compensation, the system itself, and making sure that it's efficient for the benefit of the employee and the employer. And so today we're going to talk about a few things like how is workers' compensation in Utah? What is workers' compensation? And then 4 key performance indicators that will help you get the best result out of your injury claims. So to begin, let's just talk about workers' comp in general terms. Workers' compensation's been around for about 105 years in the United States, and it is a government-regulated and mandated program. And when you hear that, if you're like me, I think taxes. But this is actually a really great thing because it's a compromise between the employer and the employee with requirements on both that helps facilitate employees being or getting the best recovery they can from injuries that happen on the job. For the employer, your obligation is just to have a workers' compensation program. Most employers do that through an insurance policy, like you being insured by the Trust. Some do it by self-insurance. Those programs have to meet all of the statutory requirements. Your employees, they have to participate by cooperating with their own recovery. And you would think that's kind of a no-brainer, but there are occasions where employees are not cooperative, don't seek the treatment they need, don't follow up on the care, and that can take away some of their benefits. And where you offer a workers' compensation program, it becomes the exclusive remedy against you. In other words, they can't sue you. They can't come after you some other way. Workers' compensation is their method for getting better and being made whole for their injuries. And then the state law also regulates medical providers, indicating how much they will be paid for services, and then also indicating that they're not allowed to balance bill or send bills to employees where they have a workers' compensation program in place. So who's covered under workers' compensation? Pretty much everybody that works for you. That includes your elected officials and your volunteers. It doesn't cover your contractors. And we hope your contracts spell that out very specifically. Also, it doesn't cover business invitees and the public who are injured while participating with your entity in some way or another. And that's why you have liability insurance. But workers' comp covers your employees and volunteers. What triggers coverage? Well, of course, on-the-job injuries and less often occupational diseases. Traveling to and from work isn't covered under workers' compensation. That's something that everybody in the general motoring public does. And so you as an employer are not responsible for that time. And it usually doesn't cover emotional distress claims. For instance, if somebody wants to make a claim because their job is super stressful or because they just had an employment action against them and they've now got trauma from that, that's not covered under workers' compensation. What would be covered on that area is post-traumatic stress disorder, and that frequently happens amongst our public safety workers. What benefits are provided by workers' compensation? Well, related medical care, and that is for life. So in other words, if somebody has, let's say, a back injury and they go through all the treatment needed and they stop treating because they're as good as medical advice and expertise can get them, but then years down the road they start having problem with that part of the back again, that's still covered so long as the follow-up care years down the road is related to that first treatment or that first injury. Also, of course, pharmaceutical benefits, and then workers' comp pays for mileage to and from medical appointments. On the indemnity side, workers' compensation provides wage replacement, whether they're off 100% of the time or just part of the time. We also pay for permanent total disabilities. In other words, somebody is just unable to do any job. And then if they're permanently totally disabled, we pay a wage benefit for them for the rest of their life. Or there's also the permanent partial disability benefit. And this is a good one to know about. If you have an employee with a fairly severe injury that takes them off of work, that requires surgery, maybe they hurt their arm, and in the end of all the care that they can get, they end up not being able to fully extend their arm. That's what the permanent partial disability payments are for. And it comes as a lump sum. And so it worries employees sometimes. They think, oh, I'm getting this big check from workers' compensation, which means that they are settling with me and I can't get any more benefits. And it does not mean that. It's just paying for that partial disability, and they can still get all of their other benefits as long as they're statutorily allowed. Well, how does Utah compare with other states in our workers' compensation performance? I have just a few slides on this. The first one here shows how quickly we get employees into care. In Utah, from the date of treatment, it's often, or date of injury, it's often the same day that we get people in for care. That would include x-rays and those sorts of things that you get with an initial visit, and perhaps even physical therapy right from day one. Utah's very good at that. We are the blue lines on this slide. And then other states, comparable states, and we're compared with 39 other states. They take a little bit longer to get employees into the system. Takes them a little bit longer to get them into physical therapy. And as you can see, takes them quite a bit longer to get to major surgery. Now, we're not saying that we rush right to surgery, but we have a corridor of care that's created here in Utah that facilitates an employee getting the care they need as soon as possible. And that helps to result in better outcomes for the employee and less cost overall. Well, how do our premiums compare? You've probably looked at your premium and said, man, workers' comp costs us a lot of money. But in truth, in Utah, it's very inexpensive. Here's a chart showing all 50 states and their premiums. New Jersey is by far the most expensive state to have workers' comp insurance, followed by Hawaii, California, and New York. And if you slide down almost to the bottom, the blue line there, number 6 from the bottom, or the cheapest state is Utah. So our premium rates here in Utah are quite low compared to the rest of the country. Well, how do we compare as far as costs go for each claim? In Utah, in 2022, the last date that we have data, an indemnity or a lost time claim cost on average $28,000 for the state of Utah. Other states, it's a little bit less. It's about $26,000. We're happy to report, though, with your help, and we'll talk about how you can help with that, and the resources that the trust has built into your workers' compensation program, our average cost is $23,351. So we are well below the state and well below the comparison states as well in our average cost for lost time claims. Well, where do our medical dollars go? How are we spending our workers' compensation money? We, again, are blue lines here, and our comparison states are the red lines. And you can see there for physicians, only 29% of our medical dollars and workers' compensation go to doctors. And you think, well, how does that make sense? I mean, they're the ones who are actually doing all the care. Well, in other states, or in Utah, we're 29%. Other states pay their physicians almost 40% of their medical dollars to their physicians. Here, we also pay more for outpatient hospital stays and for inpatient hospital stays and for ambulatory surgical centers. So you can kind of see there that in Utah, we're paying less to our doctors and more to the facilities that they work out of for workers' compensation care. And that seems to be out of whack. Well, what does it cost here in Utah for a hospital inpatient stay per day? In 2023, $5,900 for 1 day's stay in a hospital in Utah, whereas other states, it's only $3,100. So obviously we're paying more for hospitals than we should. And I've been on two committees with the state of Utah, the Labor Commission's Workers' Compensation Advisory Council and the fee committee, meaning the medical fee committee, for over 20 years. And that whole time, we have been trying to correct this problem. But I'm proud to say that this year, a bill has now passed the legislature, SB 190, that allows the Labor Commission to regulate hospital fees, which is going to drive down the costs even further, helping to improve our overall premium rates and our expenditures for workers' compensation. So just wanted to give you that as a little bit of background on workers' compensation. Now let's talk about our partnership. Working together, the trust and you as our members can provide the best outcomes for our employees if we partner in the right way. Now, of course, with as a trust member, you have advantages from our loss prevention team. And let me tell you, for 26 years, I managed claims and risk management programs for public entities elsewhere in the state. And I dreamed of having the loss prevention services that you get from the trust. I could never convince our administrators, because we are fully self-insured, to pay for what they provide. I wish we had, but they do a great job in helping to prevent injuries from happening. Referring back here in this AI generated photo to the fence at the top of the hill versus the ambulance at the bottom. With our cooperation with you, we can create great loss prevention programs, and we do, to help prevent injuries. But when they happen, we still need to have an ambulance at the bottom of the hill. Today, what we're going to talk about is how not only to have an ambulance at the bottom of the hill, but to have a souped up, totally fantastically equipped ambulance so that when an employee is injured, they get the best care, they get it early, and with the best outcomes overall, and the best cost outcomes for our employers. And we do that through our partnership together, and there's 4 things that you can do to help us with that partnership. And we'll call that the corridor of care. That is early reporting of claims, directed care or directed medical care, return to work, and then staying communicated. These are key performance indicators, and we'll talk about each one of these 4 KPIs. First of all, early claim reporting. Report all injuries no matter what. That's what we recommend. Now, you might say there's some people that get a little scuff and they don't want to report it, and they generally don't report it to their supervisors. Well, that's going to happen sometimes. But you can always report injuries on a incident only basis. So there's a record of it, which, by the way, protects the employee's interests and their rights to receive workers' compensation, but they don't have to go and get treatment. Our public safety people are really good at that. They have lots of bloodborne pathogen exposures. Just a little droplet of blood on their skin, they'll send a report in on that. Not very likely at all will anything come of that, but it's on record, and that protects the employee. Nothing else happens. There's no costs to that claim. It's just reported. I've seen a claim that happened in one of my organizations where an office worker, a lady, was wearing sandals at work one day, and she ran her big toe into a staple. And I'm not talking about a regular staple. I'm talking about one of those big staples that you can see they've sharpened the ends and they're really thick. She got both prongs in her big toe. I'm sure that hurt. But she didn't tell anybody. She didn't report it. She just put a Band-Aid on it and went on her way. And as you can imagine, being on her big toe, down in her shoes, it's not the most sanitary environment, and so she got an infection. Still, she didn't report it to her employer. She took care of it herself until finally the infection got so bad that it was either cut the toe off or the infection would spread further into the body, potentially causing more body parts to be cut off. So at that point in time, she reported it to her employer that she had been stuck by this staple in the workplace. At that point, it was too late. The time period for her to report the claim had expired. And so not only did she have to pay all of the costs for her treatment, including the amputation of her big toe, but she had to suffer the indignity of not being able to wear sandals to the beach or to work anymore for the rest of her life. And we don't want that to happen to anybody. So even if you don't think anything's going to come of it, you can report your claims. Well, what we really want to talk about is early reporting of claims. We want, as a best practice for your employees by policy, to report their injuries on the day it happens immediately. Get it reported to their supervisor. And management then has to report that to us same or next day. That's best practices, early reporting of claims, so that we can get involved and become your partner in helping to handle that claim. So what we're asking for is no lag time in reporting claims. Right now, statistically, over the last 5 years, our claims, our workers' comp claims have been reported to us 9.9 long days from the date of the injury. Now, 9 days, you've got a busy schedule. What is 9 days? Well, let's talk about that. Why is it so important to report claims? So our KPI is reported ideally within 1 to 3 days of it happening. That's what we're striving for. But what happens during that 9.9 days? Well, possibly no treatment whatsoever. And medically, some injuries in particular, if there's no treatment for a period of time, the ultimate outcome of their care and their treatment is worsened. They can't get the best results if they don't get any care early. Or perhaps they got care early, but they went to somebody else, let's say their primary care physician, and got the wrong kind of care. Well, the wrong kind of care can be worse than getting no care in some cases. We don't want that to happen. Also, you have an employee who's told their supervisor they were hurt on the job and nothing's happening. What impression does that leave on the employee? Does my employee care? I mean, what's going to happen? Do I need to go to the doctor and pay for this myself? What's going on? So you create doubt and discontent within your employees if nothing has happened. They may go get care, and then because there's no work comp claim, they may end up having to pay for it themselves or putting it through their health insurance, which is a nightmare. They may have to go get prescriptions on their own and pay for them out of pocket. And because it's out of pocket, not through an insurance, often paying much more than we ultimately would pay. And then they wonder, why is this all happening? It happened on the job. That creates, as I said, discontent. And late reported claims are an early indicator of employees seeking out an attorney. Let's avoid that. Let's put the employees at ease. This is another AI generated photo. I said, give us a public employee who's just been injured and he's at peace with himself. My wife wishes her public entity employee husband was as good looking as this guy. But anyway, put the employee at ease, show them that you care, and reduce the chances of litigation. And by the way, litigated cases cost 3 to 4 times more than unlitigated cases. And we can help that by getting the employee to the resources they need immediately. So how do you report a claim to the trust? It's easy. I recommend one of two methods. You can do it online at utahtrust.gov/claims, and there's right in there a method for reporting each of the types of claims that we insure, workers' comp included, but also the telephone. And the telephone works great. And I recommend that if you have a workers' compensation care coordinator, which we're going to talk about more, they can do the reporting. But if they're busy, empower your supervisors so that they can get with the employees and make the report right away and then pass that information on to the coordinator. There's no reason to delay it just because one person is assigned to it. You should have supervisors enabled to do that for you as well. Well, what happens? What engages as soon as you report a claim? First of all, when we have a claim, it's reported to us, it's set up and assigned to an adjuster within 1 business day. Then, as part of that setup process, the injured worker is sent an email with lots of information, detailed instructions, and we'll go over those in just a moment. There's also a confirmation to you, whoever reported it, so that you have that claim number handy right away. For larger claims, we initiate an immediate 3-point contact with the injured worker, with the employer, and with their provider if we know that they've gone to seek treatment, so that we can start to coordinate that care and answer all the questions that the employee has and get them in the right path. Well, here's some of the information that goes to our employees. We send to every employee what's called the Employee's Guide to Workers' Compensation. This is a really down-to-earth, easily worded booklet that talks about all of the benefits of workers' comp and what they can expect. It's an easy read and answers a lot of questions. We also send this other document called Injured Workers' Rights and Responsibilities, produced by the Labor Commission. Gives them their rights, their responsibilities, and lays it right out there so that there's no question what should happen in that claim. We also send a letter with some information on it, including the claim information, as you can see at the top of this document here. We also refer them to My Travelers, which is a website set up for your injured workers. Once they go there and log in and create their credentialing, they have lots of resources in there. There's good Q&A information in there. They can search for medical providers if they need to, or pharmacies that are in their area. They can see what payments have been made, what's reserved, and payments to them. They can also set up to have automatic payments sent to them if they have a lost time injury and need to get paid for some of their lost wages. Money just comes right into their account as quick as possible. It's the most efficient way and provides a lot of comfort. Also, it tells them what's your next steps. This is what you can expect to happen in this claim. This is what will happen to your bills. By the way, we might have to pay for your lost wages. This is what we'll pay and how we'll coordinate with your employer. And then finally, they get this claim ID card with their claim information, their claim adjuster's name, where to send bills, how to set up the pharmacy so that the pharmacist bills workers' comp and employees can go and get all of their medications directly. So very helpful information for them to have right up front. What we always strive to avoid is employees getting medical bills themselves. That creates huge problems. And the scenario goes like this. An employee has an injury, they go to a doctor, they don't tell them anything about their work comp claim, or they don't know it, and they just no follow-up there. And so, of course, where's the bill going to go? It's going to go to the employee. So 30 days after their injury, a bill goes to the employee's house, and the wife says, "What's this?" "Oh, that's for when I was hurt on the job. Don't worry, the city's got that, or the district's got that. They'll take care of that." Another 30 days goes by, you're 60 days out from the injury, another bill comes, and you just do nothing with it because they just throw it away. "Oh, my employer's taking care of it." Then at 90 days, a third letter comes out, and it's got a red bar across the top, and it says, "We're going to take you to collections if you don't pay this bill right away." You know what happens next? More times than not, I get a call, not from the worker, but from the spouse of the worker saying, "Why aren't you taking care of this? This bill should be paid. It's yours. He was injured on the job." And we have to say, "What bill? It never arrived at our place. We don't know about it. We couldn't have paid it." And we just hate that to happen to anybody, let alone having to pay for something up front out of pocket. We try to avoid that. Early reporting the claim is the best way to prevent that from happening. Also, you should have, and our loss prevention consultants can help you put one together if you don't have one, an injury packet that you have with your supervisors. That includes the first report of injury, the supervisor's accident investigation so that they can find out what happened and prevent it from happening again, the physician's request for return to work, or in other words, telling the physician, "Hey, we accommodate light duty. Let us know what they need. Here's a job description." And it has the clinic that you have designated as the place for you to send your employees. And we'll talk about that as well. So all of that can be in your injury packet. And again, we'll help you create one of those to help facilitate this early reporting of claims. So for this first KPI, ideally report your claims to us. So from the employee to the supervisor to the care coordinator, if you have one, and to us within 1 to 3 days. Make it a priority. If the care coordinator is too busy, can't get to it, then let those managers do it. And then track that. See how quickly you're able to report claims and figure out how you can improve that so that you get your employees into this correct corridor of care early, so for the best outcomes for them and for you. Okay. Second one, directed medical care. The benefits of having a designated clinic, and this is what we're asking you to do, is find a clinic that you say to your employees, "This is where we treat for workers' compensation." Well, here's the benefits. Early medical intervention. They know where to go, and so they just go there. There's no questioning. They don't have to ask a supervisor. You don't have to look around for somebody that might be able to do it. You've designated this clinic as where your people go for treatment of your injuries. Bam, so they can get there early. Hopefully, by getting them, if you've got a good relationship with the right clinic, they get the right diagnosis and the right treatment plan right up front, which of course facilitates early recovery and the best recovery. Appropriate follow through from them. Because they're your designated clinic, the communication channels are open between the employee, the caregiver, and the employer to facilitate their care and their return to work. And that creates good patient relations. Interestingly, that is all great outcome for your employees. But the benefits, the cost-effective benefits, and the way to do that is the same thing. You can reduce your costs by having a designated clinic where your employees know where to go, they get the best treatment, the right treatment, and the communication flows well. All of that reduces costs on your workers' comp claim. So designating a clinic helps your employee get better and helps to lower your costs and lower your frustration at the same time, in fact. Well, here's a priority list of where to send your employees for treatment. Of course, if your employee has an injury that is life or limb threatening, they need to go to the emergency room. Or if something happens at 2 a.m. to your snowplow driver, he slips out of the truck, and you don't want to leave them lying there in the ice and snow until 7 a.m. when your normal clinic opens up, of course, take them to an emergency room if they need care right away. But otherwise, avoid the emergency room at all, if at all possible, because it costs 4 to 5 times to treat in the emergency room. Also, there's another multiplier. If they need surgery and they go directly from the emergency room to surgery, for some reason, there is an added cost that's more expensive than having them be at an urgent care clinic, get referred to a surgeon, and then into surgery. It's just more expensive to go through an emergency room. So life or limb threatening, great. If that's all you've got available, okay. Otherwise, avoid the emergency room. But our hierarchy is occupational medicine clinics, urgent cares, then your general medicine and your family practitioners at the bottom. And why are we ranking these this way? First of all, because of expertise in the type of injuries that our employees get into on the job. Obviously, an occupational medicine center is going to be most familiar with those kinds of injuries, and an urgent care clinic, second most trained and have the highest expertise in that. Also, by ranking of expertise in the work comp system, there are specific rules that providers have to follow. And also, we want our providers to be focused on early return to work as a method for healing, for advancing the healing. A lot of physicians aren't that way, but occupational medicine doctors are, and certainly urgent care clinics are very familiar with that train of thought as well. And so going there helps to facilitate early return to work. Well, how do you designate a clinic, and what are some tips on ways you can find one? You can go to myworkcompinfo.com. That's a website that Constitution State Services, our third-party claims administrator, which is a division of Travelers, has set up for you to facilitate that. First, let's look at the right-hand side. You can see there from this same simple website, My Work Comp Info, you can check the status of a claim. So you just put in there the claim number and the date of injury, and it'll pull up a screen with some status specific information. It won't give you like medical diagnoses and things like that. That's all private, but you can find the status. You can also upload medical documents or bills that you receive through that same website. But right now, what we're talking about is how do you find a provider and a pharmacy that is under contract near you. So once you click on that, find a provider, you'll go to a page where you put in some specifics. You're looking for a medical provider under your workers' comp program. You say no to the concierge claim nurse system because that's not available in Utah. And then you're looking for an initial clinic and or pharmacy. Now, for pharmacies, we have contracts with most of the mom and pop pharmacies in the state of Utah, and Harmon's and Smith's and Rite Aid and Walgreens, all of those. So if you look on there, you'll probably see a few options in your neighborhood that you can put in there in your documents, your accident packet, so that the employees know they can go to any one of these pharmacies and they won't have to pay a thing for their pharmacy treatment. But for clinics, what you'll get is a list of different providers that are in your area based upon distance from you. and that they are under contract. Now, some of them, as you can see here, will be highlighted and have a red star. All of the providers on this list are under contract, and so there's a discount applied to the services that they render. But those that are starred also meet other standards of care. So, in other words, best outcomes for injuries, best communications with the employers, and other best practice indicators indicating that these providers are the best that they can get, and you can count on them to provide you with a good medical outcome. Interestingly, IHC and all of its facilities, including its Instacares and its WorkMed locations, they don't come up on this. So just know that Intermountain Healthcare is under contract, and their Instacare facilities are available for you to use. We have their WorkMed locations all along the Wasatch Front and down in the St. George area, but not really off of the Wasatch Front. But their Instacare locations are located all over the state. And those Instacare doctors, if they have questions about an on-the-job injury, they know they can call the WorkMed doctors and consult with them. And both doctors can share your records. They can see the records under the same system. So it's really efficient even to go to an Instacare if you don't have a WorkMed location near you. IHC is a good option for you. So what we recommend is you identify clinics that are in your area. Once you've selected one or two, and that selection process will likely include you visiting them and saying, hey, we are the city, or we provide your sewer services and whatnot, and we're thinking about a designated clinic, and we'd like to know how you can help us with that. Now, you may end up with a contract with them. For instance, if you want to use that clinic for your DOT drug testing or for DOT physicals, you can contract with them to do that as well. You may not need that from them. You just need them to be your designated clinic, in which case you don't have a contract with them, but you talk to them about what your policies are about return to work, what your work environment is like, who are your contact people within your organization, so that you build a relationship with this clinic. And in my career, I've also had these clinics come out to our locations, get familiar with our operations. And you can ask them, aside from care, is there any other services you can provide us? And some of them will say, sure, we can provide you training in certain topics. Like I've had them come out and do training on working in the heat or working in the cold, or what to do with animal or bug bites, and first aid care for broken legs and sprains and strains. They do that all the time, and sometimes they would be willing to come out and train you on that. They might even be willing to let one of their physical therapists come out to your locations, look at a particularly physical job and say, you could do this in this way, and that will help prevent injuries. So you're building a partnership with these clinics. They know you, you know them, the communication flows, it builds trust, and it builds efficiency into your program. Over the last 5 years, interestingly, 93% of our medical dollars have gone through these clinics. So even if you haven't designated one yet, you've probably been able to take advantage of some of the cost savings, but not these other efficiency savings. But to give you a scale, the 7% of our medical bills that did not go through one of our contracted providers, we spent 1.2, almost $1.3 million in medical care with non-contracted clinics. So you can see there's big money on the line, even though we're at 93% at these clinics. So key KPI, designate a workers' compensation clinic and build a relationship with them. Let's talk about return to work now. From the Employee's Guide for Workers' Compensation from the Labor Commission, an employee can return to work after a treating doctor releases the employee to light duty or full duty. If an employer accommodates suitable light duty work, the employee is required to accept the work or risk losing their temporary total disability benefits. So return to work, either on light duty or full duty, is after the doctor has medically cleared them to come back to work. If it's on light duty, which is what we strive for in every case, they're going to have some limitations. And so they release the employee with some information of what they can and cannot do in that light duty position. If an employee chooses not to take that light duty assignment, that's fine. we stop paying their wages and they start taking leave, whether that's sick or vacation leave, for their time away from work. Well, why return employees to work? Here are several things or reasons why you'd want to do that. And let's break it down by benefits to the employee and the employer. Why for the employee? Well, it promotes healing. Studies have shown that returning an employee to light duty can reduce the recovery time, the overall recovery time, by 30%. So in other words, your employee has a whole lot less time convalescing, suffering, being treated before they're back to whole. Also, it reduces medical costs by 7%. That's just the medical costs. It reduces it by 7%. It also reduces atrophy and helps to maintain fitness levels. Getting an employee out of bed, off the couch, coming to work, doing whatever work. They may have a position that requires them to sit, but they still have to get there and move around every once in a while they're on the job. And so it helps to reduce atrophy. In 2018, I had a major surgery on my right leg and had to be off of it fully for 4 weeks. At the end of 3 weeks, I started to do physical therapy and I looked down at my leg and it was amazing how much of a chicken leg I had developed. It's like ready to cook. It was so thin compared to my other leg. It was alarming, just frightening. You can help avoid that by bringing them back to work and getting them moving around within the parameters the doctor set. It also helps to maintain their mental acuity and their skill set. Skills are perishable, and so the longer they're away from doing the job they've been trained to do, the more they forget. And seems to me that often what they forget first is the safety requirements of that job. And mental acuity. You can imagine the devastation to a brain that sits on a couch for weeks on end, watching daytime soap operas and commercials from attorneys. It's just not good for your mental health. And then finally, returning them gives them hope and returns them to the sociality, the relationships that they're used to being with day in, day out. They may not like everybody at work, but they like the relationship and the interactions. This brings them back to that and gives them hope for a full recovery and a better future. What are the benefits to the employer? Well, reduce disruption to your workplace. When an employee is gone, somebody else has got to do their work. If you can get that employee back to do part of their work or other work that's just not getting done, the employer wins. You get that benefit. Also, it boosts morale because the employees that are taking over those assignments see that the employee is doing what they can to get back to work and that there's a sunset to how much time that extra workload on them will last. Also, it boosts morale because they can see that you care about the employee and their recovery, and they extrapolate that for themselves. It saves you money, and we'll talk more about that. It reduces the chances of litigation. The longer an employee is out, the more likely, again, they are to hire an attorney to help them with their claim. And we try to avoid that as much as possible. And it reduces employee turnover. Well, let's talk about how it saves money. And that really kind of relates to not only the cost of the claim itself, but directly to your premium. And that's through the experience modification factor and your premium. As we call that EMOD, but experience modification factor is what it implies. Your experience as an employer, meaning how low you pay in your workers' comp claims, how few days off you have for your employees, how few injuries you have compared to another employer that's similarly situated, and that factors into your premium. EMODs are designed either to punish employers that don't have a good program for prevention and good recovery, or they reward employees that do have those programs. And that they do that through, first you have your manual premium, which is simply your payroll to your class codes, and then there's a rate applied to that. That comes up with your manual premium. Then your EMOD is attached to that, which increases or decreases your ultimate premium. Here's a couple of examples. City number one has a great program. They return employees to work. They have few injuries. They've got a designated clinic. And so they have a $250,000 payroll at $10 for every $100 of payroll. That's their premium is $25,000. This is all just round numbers. Well, because they have a good experience, their EMOD, their experience modification factor, is zero point 0.7. The average employer is a 1.0. That makes sense, right? One is average. If you're below average, zero point 0.7, that means you're better than average. Apply that to your premium. Your premium turns to $1,750, a savings of $7,500 in just your premium alone. Well, city number two, same payroll, same manual premium, but they have a bad experience mod. So they're not returning employees to work. They have a lot of injuries, more than they should be having. And so their EMOD is a 1.25. So that 25,000 is multiplied by 1.25, giving them 31,250 as their premium. An added premium because of bad experience of $6,250. So that's not good. That's a spread of over almost $14,000 for employers with the same payroll because of their experience modification factor. Well, how is that factor developed? It's based upon your losses of the last 4 years, but the first 3 years in those last 4 years. So you don't count the year that just ended. You wouldn't count 2024 right now. So since it counts 3 years, they hang on. Your bad experience, your good experience hangs on for quite a long time to affect your EMOD. And then it's based upon class codes and expected losses. And then some types of losses are limited and others are not. For instance, your medical only claims, no lost time. Now, you can have an employee who's off the rest of the date of the injury and 3 days after that, and still it's a medical only claim. Though that time off is paid by the employee, and that's part of the compromise that is workers' compensation. But once they're hit day 4 and they're off, that becomes an indemnity claim. Medical claims are counted towards your EMOD at only 30% of the medicals. Indemnity claims or lost time claims, 100% of those costs. And those are capped out and they are limited the bigger they go. But 100% of those costs versus 30% is pretty easy to see which one you'd rather have. And that's a medical only claim. So lost time claims compound your costs. Your medical costs go up. Your indemnity costs go up. Your EMOD goes up. So you want to avoid those as much as possible by having a return to work program. Here's how to develop one. First of all, create a policy that creates an
Hey,
expectation.
Jeff, real quick, are you still
Uh-huh.
sharing your slides? Because we don't see them anymore.
Nothing's changed on my end. Let me try it again. Stop share.
I could see him, Mike. I don't know what happened on your end.
I don't know what happened on my end then.
Give me just a second here.
Just go ahead and hit share again. I think, yeah.
Can you see it now?
Not your slides, just your screen.
How about that?
Now I've got your presenter slides, presenter notes.
Okay. Let me try again.
Well, geez, it looks like I was the only one that was having an issue. I'm so sorry.
Thanks, Mike.
But while we have a little break in here, we do have a couple of questions that have been hanging around. I'm not going to give those to Jeff right now because he's right in the middle of technological stuff. So,
How's that?
still seeing your presenter slides. So you could hit that
Swap display.
swap.
Share. Right again. Go ahead and fire a question.
Okay. Question one is there a spot that the employer can print out the claim information cards to give to the employees?
When you say a spot, I don't know of a spot where you can do that, but you can create your own. Am I right now in the presentation?
Yes, that's nice.
Yes.
Thanks.
Okay, good. You could take the information, and if you want to call me, I'd be happy to give you like the address and the pharmacy, all that information, or you can get it off these slides because the pharmacy information and the billing address would be the same, and just create your own to put into your packet.
Awesome.
But if you have something else in mind, feel free to give me a call. and I'd be happy to walk you through that.
And one other quick follow-up question here. We've been waiting for a little bit. The slide mentioned employees not covered to and from work. Does that change if an employee is on call and responding to a call out?
Absolutely, it does. Another thing that may change that is if they're driving your vehicle. So if you have a take-home policy and they're in your vehicle on the way to and from work, those are exceptions to the rule. And the reason that on-call employees that are responding to and from is an exception is because at that point in time, they are on the clock. So they're commuting to wherever they're responding to, not their normal day-to-day commute. But if they're just normally traveling to and from work, that's not covered because that's a general risk that everybody in the public takes. Also, if they're in your vehicle, there is a Supreme Court case that came down on this, and they said there's enough benefit to the employer that you put them in your vehicle to take home. So that creates the nexus between the employer and workers' compensation. So great question. Any others, Jason?
Nope, that was it. Thanks, Jeff.
Okay, well, let's roll. So as I said, you create a policy and an expectation that you will return your employees to work. You develop job descriptions for your most physical jobs. So your public works people, for instance, what is it they do? What is it required of them to do? Just basically describe those physical characteristics. You get pretty detailed in that, and you don't have to, though, just describe it. So it's different than you'll be hired to do this task, this task, this task. Rather, this task requires them to do this and that. And then a doctor can take a look at those and say, I can see that they can do this, check that. They can't do that, put a line through that one, so that when they come back to work, you as a supervisor and the employee know exactly what duties they can do. And then identify alternative duties. So in every area of your organization, you probably have some work that's less strenuous than others. Or you may have tasks that have been sitting around forever and people do them when there's extra time, whenever that happens, and so they never get done. Identify those things. And it doesn't have to be within your department. They can be across the whole organization. The idea is to create efficiency by bringing the employee back to work to help you as an employer. Also, because it's a benefit to your employees, some of our members, and another best practice is if you don't have anything, are there community services that could use a hand? For instance, maybe they can deliver Meals on Wheels, or we have some that send employees to the DI for the day to work there, so long as it's within their restrictions. And then communicate with the adjuster and the provider about your policy and the assignment so that you have open communication and everybody's on board. Big KPI, return your employees to work, and this is how you do it. And Jason and Mike would be eager to help you build a return to work program. Finally, and this will just take a few moments, stay connected with the employee. It's super important that they know that you care about them. We recommend having a workers' compensation coordinator or a care coordinator. That's somebody who coordinates the reporting of the claims. Again, it doesn't have to be them, but when a claim is reported, they need to know about it. So they become familiar with the benefits of workers' comp, the adjusters that we assign, they get familiar with me, they know your clinic and who the contacts are, so they can facilitate the flow of information and the flow of actions. They oversee the return to work program. Of course, supervisors play a big role in that, but the workers' comp coordinator can coordinate that within your organization and between departments. Stay in touch with the injured worker and address questions and concerns. And as far as the supervisor goes, communicating frequently also helps. Imagine an employee who's used to talking with you as a supervisor every day. Now they're sitting at home and they don't hear from you. They're going to think, does that supervisor really even care about me? Is my job even that valuable to them? So just calling them up, saying, how you doing? Don't ask them what their diagnosis is. We can't ask that question. That's a medical privacy issue. But I'll tell you what, if you say, hey, how's it going? 9 times out of 10, they're going to say, well, this is what happened, because they want to tell the story. And they'll tell you how long the doctor says they'll be out and that they have to do physical therapy and it's been painful. And letting them vent to you helps them feel that you care. And your compassionate response to them and talking to them about what's going on in the workplace keeps them engaged and helps to improve their morale and their mental state, which also improves their healing. So in summary, we are partners. We have set up the best medical services, deepest claims experience, good communication standards and protocols from our side. And we partner with you to help facilitate the best outcomes for your employees by your reporting it to us early to engage all of those services, by having an established medical relationship so you get the best care that's available in your community, by having a return to work program, and good communications. These 4 KPIs are critical to reducing the stress, the workload, the impact to your employees and your organization of these workers' compensation claims. And as one final note, some of you, or maybe all of you, have heard about the new Trust Integrity Promise Program. This is a long-term program that we are just starting now, where we help you build in certain standards of good risk management, and those standards lead to reduced costs in your premium and in your claims. And at the end of 5 years, it also waives a premium. So if you're not familiar with this program, it's coming your way. But 2 of the key things that you need to do in this program is have a medical network, a contracted clinic, and a good return to work program. So thank you for letting me take your time. If you have questions, if you want to run a claim scenario by me or whatever, give me a call anytime. I'm here for you, and I'm open for questions. Thank you.
Folks, if you've got a question or a comment, please type that into the chat box right now, and we will get Jeff to answer it. Wow, Jeff, lots of stuff. That was a great presentation. It's something that we really just can't let happen on its own, right? We've got to be involved.
And I mean, we see the difference
Yeah.
in the outcome for the employee and the costs on a daily basis, and it doesn't need to happen. Considering that employees are your best assets, and for most of us, they're friends, we want to do the best we can. If we can't prevent the injury, let's get them healthy as quick as possible and in the best way.